Hello everyone, welcome to this channel, and today I am going to give you some idea about Posology. So Posology is derived from two Greek words. Phosos means how much and logos means science or study. So Posology is the branch of medical science that deals with dose or quantity of drugs to be administered to an individual patient to get desired therapeutic outcome. Now, in posology, the dose of a drug is calculated depending upon various factors such as age, body weight, sex, etc. Now, first factor is age. Age is an important factor because there is a pharmacological term, pharmacokinetics, which means the absorption, distribution, metabolism and excretion of drugs. Also, bioavailability comes under pharmacokinetics. So, in case of children and newborn, several mechanisms of our body such as hepatic metabolism, renal excretion, these are underdeveloped or immature as compared to the adults. And in case of old aged people, that is greater than 60 years, these mechanisms are slow, that is hepatic metabolism and renal excretion, these are slow. So, for that some formulas are incorporated to calculate the dose. In case of children greater than less than 2 years, Young's rule is used, Young's formula, which is adult dose into age divided by age plus 12. For greater than 2 years of age, that is Cowling's rule, and the formula is adult dose into age at next birthday, that is in years, divided by 24. And for infant less than 1 year, Frye's rule is employed, and it is adult dose into age in months divided by 150. Now I will give you some example of drugs and comparing them. In case of newborn, chloramphenicol, it is an important drug, so which causes grey baby syndrome due to inefficient metabolism and which causes drug accumulation, and due to this accumulation grey baby syndrome occurs. So, for that dose reduction is required. In children, they need lesser than usual adult dose due to their pharmacokinetic profile because their metabolism and excretion is immature, and so for that they need lesser dose as compared to the adults. However, children can tolerate more amounts of belladonna, alcohol, etc. So, these are basically tranquilizer and narcotics, and as contrary to the older aged individuals, because they need lesser dose due to their pharmacokinetic profile. Children need lesser dose, but they can tolerate more amount of belladonna, that means hypnotics, etc. Whereas the older people need lesser dose due to their decline of functions of both the liver and kidney, but they are sensitive to diazepam and morphine, which are basically the hypnotics as compared to the children. So, for that dose calculation is necessary. In case of children or infants, these formulas, that is Young's rule, Cowling's rules, Frye's rule, these are used to calculate the dose of a drug, and in case of older adults, it is calculated based upon different other factors, because older people take many drugs and they have many comorbidities like diabetes, hypertension, etc., and for that dose calculation is required for them, and this is calculated depending upon these factors for older individuals, older aged individuals. So, this is a brief discussion regarding posology, and I have discussed just one factor here, age, and I will discuss other factors in my other videos. So, till then, see you in my next videos, and if you guys like my videos, please subscribe the channel. Thanks for watching.